everyone, nice to meet you through TV. I'm Dr. Malignant from Hepatobiliary Department of the first affiliated hospital of China Medical University. Today, let's study together about malignant liver tumor. First, we studied part 1. The contents includes anatomy of the liver, prevalence, and etiology. First, malignant liver tumor includes primary liver tumor and secondary liver tumor. Most primary liver tumors are HCC, hepatocellular carcinoma. Then we studied the anatomy of the liver. In liver parenchyma, branches of portal vein, hepatic artery, and bile ducts distribute in the same direction. They are surrounded by a layer of fibrous sheaths. All these are called Gleason system. A French surgeon and anatomist Conrad did a great contribution to the understanding of liver anatomy. He gave a cornered subsection method of the liver. Altogether, liver are divided into 8 segments. This subsection is very useful when we perform liver surgery these days. The liver has a dual blood supply consisting of hepatic artery and portal vein. The hepatic artery delivers approximately 25 to 30% of the blood supply, and the portal vein delivers about 70 to 75%. Oxygen is very abundant in hepatic artery, and the blood flow into the liver is about 1,500 milliliters per minute. The hepatic hilum can be blocked for about 15 to 20 minutes under normal temperature. So if the hepatic hilum can be blocked in the operation, it's only about 15 to 20 minutes. Then we talk about prevalence of malignant liver tumor. This is the latest data from the famous magazine called New England Journal of Medicine. In the year 2019, as estimated, about 750,000 new cases of hepatic tumor are diagnosed annually. Among all kinds of malignant tumors, the incidence is 6. And mortality is 4. So, liver cancer is a tumor with poor prognosis. Liver cancers occur all over the world, mainly in Asia-Pacific coast, Southeast Asia. The incidence is different in all parts of the world. It is 22.3 per 100,000 persons in China, and 14.2 per 100,000 persons in Southeast Asia. But it is only 4.2 per 100,000 in Australia and 6.1 per 100,000 persons in USA. So the incidence is very different in all parts of the world. The incidence of liver cancer is higher in China, Southeast Asia, and West Africa, and East Africa in sub-Saharan area. The incidence of liver cancer in Europe, Australia, and North America is relatively low. One of the common malignant tumors in China is primary liver cancer. And in China, the morbidity is higher in some South provinces like Jiangsu province, Guangdong province, and Guangxi province. This slide shows prevalence of the top 5 malignant tumors in China. At the left, we can see that the incidence of liver cancer is 5th. On the right, we find the mortality is 2nd among the top 5 cancers. So liver cancer is also a great threat to Chinese people. Then we study the etiology of primary liver cancer. Each may have relationship with these factors. The first and the most important factor is chronic liver disease, chronic hepatitis B and chronic hepatitis C, or cirrhosis caused by HBV and or HCV, and cirrhosis caused by alcohol, or cirrhosis caused by non-alcoholic steatohepatitis. And the cause of the chronic liver disease in east part of the earth and west part of the earth is different. In East Asia or China, the chronic hepatitis are almost hepatitis B, but in Western countries, they are almost all HCV. The second factor is certain natural chemical carcinogens like nitrosamine, organochlorine insecticides. And the third factor are other factors, include intrahepatic parasitic infection, malnutrition, inheritance, environment, etc. And the fourth is a special factor in China or Southeast Asia. It's a toxin from fungi. The name is aflatoxin. And this is the end of the first part. Thank you.